Welcome to another episode of Scanning the Market. Today we're joined by the CEO of Riverain, Steve Worrell. We talk about running a profitable AI company, his journey through the CAD market, and advice for anyone trying to build an AI company in the future. Enjoy. The technical background into sales is quite rare. Normally you'll find clinical moving into commercials, but this sort of leads me into my first question with you, actually, because you're running a commercial company now, but you come from a technical background, right?
Correct. Yes.
So was it iCAD? You were probably one of the first early adopters of what we know as AI now, but
That's
as CAD
true.
back then.
I was definitely doing AI before AI was a thing.
Yeah. Yeah, you're the open AI of when was River? Well, probably early 2000s, right? Um,
Yeah. Basically, believe it or not, even before, so like I joined a company, Quality Computing, which became CADX, which then got bought by iCAD. So I joined that Quality Computing, I think it was like 1998, right? So small startup, breast imaging. But then I sort of had that was sort of a transition for me, right? In that I was doing military research
sure.
prior to that, doing machine learning, right? And so I kind of, call it a midlife crisis, whatever. I decided, you know what? I want to do something else. And so I joined that small startup in breast imaging, right? And it was attractive to me because, totally different domain, of course, right?
Mhm.
Still a lot of the skills, et cetera, right, that I had developed were applicable.
Yeah.
And so, yeah, I'm really dating. I'm pretty long in the tooth.
Yeah, now iCAD just got bought by, was it Deep Health?
Yep,
Yeah, that
exactly.
was, I mean, that's a good purchase for them. Um, and so you joined Riverain in as like a
2000,
VP of research role.
correct. Yep, exactly.
And and so by that, and obviously you don't have a clinical background. So um, what I'm kind of interested in knowing is, I mean, we'll get into the success of Riverain, but I was interested in why you found, or what about Riverain was attractive to you back then, because I'd be interested to see what was interesting then and sort of stage where you're at now.
Yeah, so I was with iCAD at that time, right? And some of it was like, so I really enjoyed iCAD, right? So because I joined it as a very small startup, right? And then we got bought by iCAD, and I still liked the culture of the company. I liked what we were doing. Uh, and then I guess it was about maybe say 2006, the leadership changed again at iCAD. It seemed like it was in constant state of flux. Um, and what became pretty evident to me was that if I were going to stay at iCAD, I would have to relocate to where the heck were they? Just outside Boston, New
Sure.
Hampshire, right? And and then an opportunity presented itself, namely Riverain, right, whereby two local businessmen were reforming the research and development department of Riverain because
Sure.
they were dissatisfied with the group that was out of Maryland that they sort of acquired through an acquisition, Dave's Technologies, right? And so it's like, wow, I really like the idea of, staying in healthcare, first of all. Second of all, um, I like the fact that these two gentlemen, quite well known in the community, right, had sort of purchased the company, seemed very committed to the community,
Yeah.
right? And felt like a great opportunity, right, to join the company at that time, right, as vice president of research. Huge amount of respect for the two investors. Um, so that was really the sort of the catalyst, right?
Mhm.
So less so the fact they were doing lung,
Yeah.
right? But I um as I say, in principle, I like the idea of working in healthcare. It was sort of, you know, different organ, but many of the same challenges, many of the same technologies, right? And
Yeah.
I like the fact that, they were building a group, right? And that sort of commitment to the community.
Yeah, and a lot of you, from my knowledge, a lot of you have been there from not quite the beginning, but from yeah,
Pretty long
10,
time.
10 plus years. Yeah,
Yeah, exactly. Yeah. So we definitely have some fairly tenured people. I don't did you probably knew Jason, right? Knapp?
yeah,
Did you know?
yeah. No,
So
Jason.
like, yeah, I mean, I go way back with Jason, right? So we were actually at ICAD together.
Yeah,
So, so as you know, no doubt, right? He left recently,
yeah.
right? But he was here 15 years, right?
Hmm.
On that order. So we have a few people that have been here that long, including myself. And then also, ironically, I've pulled in several sort of ex ICAD E's,
Sure.
right? So we probably got, I think we have, if I include myself, probably about 5 people on the team that go back to the ICAD days.
Yeah, I think it's so. It's a funny one, and we'll get into it down the line. But when you're trying to build a company, you want to pull different experiences, right? You want people from different companies, different backgrounds, different experiences. But at the same time, you kind of need a core group of
You
people who
do.
know each other.
It's so like, it's just it's really challenging to find good people,
Yeah,
right? And you know, known entities are quite attractive therefore,
yeah,
right? It's like,
yeah,
okay, I know this guy works hard, is competent, right? Will sort of, culturally work, so to speak, right? And
yeah,
so, yeah, for sure.
yeah. I mean, yeah, maybe not so much now, but when you're starting early, you're not that commercial, and you're running on a shoestring budget. You know, it's it's red or black, isn't it? You can't afford to just gamble on something that could work off.
Oh, it's so true because I mean, so like we raised 15 million in 2019
Mhm.
and you know, with 15 million comes expectations, right? From a growth
For sure.
standpoint. And so, I made more mistakes than I care to admit, right? With regard to hiring people.
Yeah.
Hiring hiring people in my mind is hiring the right people is probably one of the most challenging aspects of building a business.
Yeah. Yeah,
So
for sure.
so
I mean,
people like yourself that bring good people to the table, invaluable.
yeah, I mean, it's tough, especially I wasn't in the market, like, 10, 15 years ago, so I don't know what it was like then. But now you're trying to get the best people, but you're also competing against a ton of other companies who are also trying to get the best people. So you
Yes.
you then have to balance, in an ideal world, you'd interview someone 10 times and you'd make sure that they are the right person. You'd trial them for a week, you'd do everything.
Yep. Yep.
But you have your competitor who's also trying to hire them.
Exactly.
Um,
Yeah.
and so I don't know, it is still a massive gamble, and you can
It is a
mitigate
big
those
gamble.
risks,
You can
but
mitigate it to a degree, but what I've found is that and, and this is something that you have to correct ultimately, is a, you know, non-rigorous interview process,
Mhm,
right? Because I think, and I've seen this particularly in the context of, I think, research and development, right? Is that, in many cases, they don't want people that they're interviewing to be uncomfortable,
mhm,
but really to make sure, I mean, you really have to test people,
yeah,
right, on the technical level as part of the interview process. Otherwise, you get surprised, right? So, if all of your assessment is sort of soft, right?
yeah,
And yeah, these are good people and maybe they have good pedigree, etc., right? But it's just so easy for people to get in the door, right? You
yeah,
hire them and then, you know, it becomes emotional, financial toll that you ultimately pay for making that bad decision,
yeah.
right? With regard to hiring.
Yeah, I mean, you also don't want to be known as a revolving door, right? The first
Exactly.
question people always ask me is this a new position or did someone leave?
Oh,
Um,
really? That's
yeah,
interesting.
it's such a common question because, my job is to give them the full context, right? And if
Yep.
someone left for, if it's a good reason, then, they left for a bigger opportunity, then great.
So
But
be it. That's life. That's kinda like
that's fine.
Jason, right?
Yeah.
Like, Jason and I, like I say, went way back. I was shocked when he
Uh-huh.
resigned, right? But, you know, as he explained it, in his mind, he wanted to do something different, right? He wanted to do things at a larger scale, and
Uh-huh.
he felt like it was like a once in a lifetime opportunity,
Yeah. Yeah. I
right?
mean,
And
you,
okay, you can't fault people for that, right? It's like,
no.
go for it, right?
Yeah.
Yeah. Yeah.
Yeah. Yeah. You can't hold people back. And I guess sort of segueing off what you said about doing things on a larger scale, I spoke to uh, Ayers Medical last week, a lady called Gina Park, who's their chief strategy officer, and they have a tool that optimizes MRIs. So it's a real workflow focused tool. And I was
Yep.
asking how, in my mind, AI is segmented into workflow and diagnostic, right? And if you can sort of blend both perfectly, then you have a winning recipe.
Yep. Yep.
When you were developing this product, they developed it with their product with ROI in mind, right? This will get more patients through the door, which will make the hospitals more money, which will ultimately get more patients, quicker access, right? It's very, very
Yep.
simple. But I feel like with diagnostic AI, you get a better image, great. Or it can go and detect a lung nodule, great.
Yep. Yep.
But if the radiologist has to do a ton of clicks, then
100%.
they don't
They
want to
won't
do that.
accept it. They
Yeah,
won't accept it, right? It has to be, it's and like in our case, it truly is a combination
yeah,
of accuracy and workflow,
yeah,
right? Because I firmly believe, right, that you could build a much better mousetrap, right?
mhm,
From a raw performance perspective, right? But if that is clumsy, doesn't integrate into the workflow in a seamless manner, it won't be adopted, right?
yeah,
Or at best, it will be a challenge, right, to have it be adopted.
yeah, yeah. And I
Um,
guess, yeah, with yours, obviously the suppression system. I mean, it just makes it. If I can see a lung nodule and that's me, and I couldn't tell the difference between one or not, then the radiologist's job is made
yep.
that much easier.
It is,
And I guess,
and yeah, that was
yeah,
one of and we kinda learned this lesson, and sometimes we still forget it and we have to rethink it again, is that, you know, radiologists, of course, are very visual, right?
mhm,
And, our first entry into AI-based tools for purposes of improving image quality was bone suppression.
yeah,
Right? So we take a standard chest X-ray, we subtract the bones electronically. And so, believe it or not, bone suppression was developed initially for the purposes of improving the CAD, the
sure,
automatic detection. But what we sort of found out in the process of introducing bone suppression was that resonated more with the radiologist than did the automatic detection component,
sure,
right? And so that was a lesson, and there's a multitude of reasons for that. Maybe one is whether this be vessel suppression, both true in both cases, vessel suppression, bone suppression, right? So, like, one, it's intuitive to
yeah,
the radiologist. Two, they're very accustomed to looking at imagery, right?
mhm,
And so therefore, something that sort of improves image quality, right? And the more and of course, bone suppression and vessel suppression, it's not just improving image quality, it's going beyond that, right? It is
yeah,
improving conspicuity of disease, right? But
yeah,
but they're very visual, tools that are intuitive, tools that integrate into the workflow, very easy, right? It's either just another series or another image. It gets in the patient file. They just look at it like they look at any other images. So very accepting in that regard, right? And so And then I think the other thing with regard to bone suppression and vessel suppression is that, a big challenge with AI is like it's a bit of a black box,
Yeah.
right? Well, both bone suppression and vessel suppression sort of gives a little bit more visibility, so to speak, into the CAD decision-making process. I
Hmm.
think that resonates well.
Yes.
And then of course, if it's easier for the eye to detect nodules, say, right, then it follows that it should be easier for a machine to detect nodules, right, based on this representation of the data.
Yes.
And so yeah, so those, but I think, and then of course, the other thing is uniqueness,
Yeah.
right? There's so many Me Too products out there, right? Lung
Yes, for sure.
nodules, most definitely, right? And so, like, from a differentiation standpoint, vessel suppression is like a home run. We
Yeah.
own it, right? We have patents on it. One, two, um, it just, as we were saying, very sort of intuitive to the radiologist. It gives them a little bit more insight as to why the CAD marked what it did,
Yeah.
right? Which is really important to them.
Yeah. Yeah.
Yeah.
You need to understand the why,
The
and
why.
the why is so
Exactly.
important.
Yeah.
I guess leading on from why, I think it's easy to come up with ideas, and you have a lot of smart people working for you who probably come up with crazy new products all the time, new advancements, new updates, so on and so forth. And then they get through to you and you're like, this just isn't going to work. So
Yeah.
how do you decide what, what radiologists receive and what stays sort of in the workshop?
Yeah, so I think so. Like, so we lean on our clinical advisory group pretty heavily to vet ideas, right? Ideally, the sooner the better, right? Like,
Yeah.
you know, what are your big pain points? What would you like to see in the market that doesn't currently exist in the market? If you're using tools, how good are those tools?
Hmm.
And what are the issues related to those tools, right? And so
Yeah.
we vet things as much as possible up front, right? But it's not uncommon for things to sort of, you know, to meet forks in the road
Yeah.
along the way, right? And then you got to make decisions like maybe something, maybe your scope was too large,
Sure.
right? You were trying to do too many things at once. And so you got to sort of prioritize. That's sort of an ongoing basis.
Hmm.
Um, we also vet those kind of things with clinicians, and then, we've had a couple instances where, we essentially built a product, right? And then we paused on that product, or that product didn't pan out as
Yeah.
well. It's like one in particular I know, we went all the way through building the product, doing a clinical trial, and this is for a pulmonary embolism detector,
Hmm.
right? And the performance just out of the trial, we probably still could have got FDA, but out of the trial, we were disappointed about the performance. We knew the market was pretty mature
Yeah.
already, right? Like ADOC had a good PE product. We knew they had a good PE product. And we felt like at that time, this was maybe say 2 years ago, like the trains left the station, right?
Yeah.
They're already building the back end, right? Sort of the patient
Yeah.
care function, and we're not monstrably better, right,
Yeah.
than their front end, and it just felt like we're just throwing good money after bad, you
Yeah.
know? And
Yeah.
so, yeah.
Yeah. Sometimes I think companies can be guilty of chasing things
Oh,
that aren't necessarily.
pride
And when,
pride comes in,
oh yeah,
right? Pride
yeah,
comes in. Any
yeah,
good engineer doesn't wanna let go.
no,
You
and when,
just gotta pull it away, right?
oh yeah,
Y
A-
Yeah.
and when you have pride fueled by $15 million of funding, $50 million worth of funding, $100 million, some of these companies, yeah,
Crazy.
we're going to go after the entire market, right?
Right.
And then you go too broad, and then you have
Oh, big,
no real
big,
offering.
common mistake.
Yeah,
Really common mistake. And I
yeah,
think, so like we've all heard what happened to Bear,
uh-huh.
Blackford, and I really honestly think, um, and this is not limited to them, right? But I think a big underestimation, if you will, on the part of platforms was like just how messy data is,
Yeah.
right? So if I'm trying to cover every body part, every modality, right? I mean, you're really taking on a lot,
Yeah.
right? Because I know even in our case, like when we install direct, right? So like if you get to um a health system that's of any size, right?
Yeah.
There's no standardization, right? They throw everything in the kitchen sink at you, and you have to resolve what's relevant versus what, right? And so to just try to do that across many different modalities and many different organs and many different diseases, I
Yeah.
just think people, a bit naive, right?
Yeah.
Now ADOC's pretty successful, right? Good for them, right?
Yeah.
But now I think they've had $350 million or so invested, right?
Yeah.
And so, you know, um,
How do you exit from that?
how do you well, that's to be determined, right?
Yeah. 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 That's the
Um,
that's
yeah,
the $500 million question.
I would yeah, and I don't know what their revenue. I suspect they're probably not at they're probably 50 million or so, I would
Yeah, I
guess.
think that's similar to what I've heard,
Yeah,
yeah.
yeah.
So it's just
They got and then, they're gonna have to grow into that valuation, right? So, like, I
mhm,
think their last round, I think I saw, like, they were $1 billion market cap sort of valuation. It's like, if you're at 50 million, you don't quite deserve that market cap, arguably, right?
yeah,
And so even if you're, like, doubling ARR, say, right? And so, they're gonna have to grow into that, right? And so, like, and the other thing with healthcare, and I've seen this time and time again, and this is particularly true when people raise money, sometimes large sums of money, um, you know, they underestimate the inertia of
yeah,
the market. So they get themselves in big trouble, right? So they just raised around, they go out and hire a bunch of people, and so their burn's very high,
yep,
right? And even if they have a good product or products, right? You know, the delay in creating meaningful revenue is such that they just get over their skis so
yeah,
fast.
yeah. And
Seems to happen again and again.
yeah, it happens so many times, and there's a couple big names I think it's happening with at the moment who have raised, hundreds of millions, and then
Wow,
you're seeing a ton of people departing. Um,
interesting.
and from my perspective, I first saw this with um, there's a company I used to work with in the UK, and they got taken over by a VC, and they went from 15 people to 60 people in 6 months, and
Impossible.
after 6 months, they were back down to 15 people, and uh, as much as you can put blame on the people leading the company. Like if you're giving money, you're going to spend it. So I
And
don't
there's the pressure.
Yeah,
Right? Because these it's kind of like what I was telling you, right? So like with money, even at 15 million comes expectations, right?
yeah,
And so, and you can't get there with the same team that you have
mhm,
now, right? And so you're sort of your only response is to hire and hire fast, right?
yeah,
And then you end up hiring the wrong people,
yeah.
right? And it ends up causing more problems than solutions.
Yeah, for sure. And I think the problem is we're starting to see the VCs are running the companies.
Mm,
And th- the issue with that is that these VCs, hey, look, I know to sell a pack system, it's 12 to 18 months, right?
exactly.
To sell your
Probably
product.
probably on the light side,
Yeah, exactly.
right?
There's a big enterprise deal. You're looking at 2 years, right?
Yeah,
For your
yep,
product, what you could look at 3 months, 6 months, a year, maybe.
100
Um,
some of the bigger accounts we have, right? Uh, you know, that first touch may have occurred 3 years ago,
exactly.
right? So it's not a heavy s it's not like you're investing heavily in this customer, but the bottom line is that customer expressed interest, and they didn't actually pull the trigger for
Yeah,
it's 3 years. Some
yeah,
Northwestern comes to mind.
Yeah.
I mean, I was talking to those guys, it felt like forever, right? And
Yeah.
it's like, finally. Yeah.
Yeah. Yeah.
Yep.
It takes time. And I think those expectations aren't aligned. And so those
100%.
pe
100%.
people, they don't realize that um, it takes this long. Like, you need to be investing for 10 years in the future, not for the next 24 months. Which,
Exactly.
again, I guess now we're talking about the commercials. I mean, we can obviously cut this out if you don't want it to. But the one thing about you guys is that if I'm pretty sure in saying you're profitable, right?
Yeah, yeah,
Yeah.
yep.
And
We've stayed
I
small. We've stayed
yeah,
quite small, right?
I don't I genuinely, if you go and look at a Blackford or you look at a Deep Sea and you look at all of the companies on on their platform, I would put good money that you guys are the only profitable one. Um,
I suspect that's true, right?
Now, I guess, of course, the answer is going to be we have a great product, which you do. You're one of the first to market. Yeah, I think of other companies like yourself, like Heartflow, for example, first to the market with their like their plaque software.
Yep.
Um, do you think it is just a great product, or is there something that you actually have deliberately done to be able to run a lean ship and sell
It's great.
enough to make money?
So my feeling is a great, very good product is a necessary condition, but
Yeah,
not sufficient, right? So, and basically what that means is that, I can put as much lipstick on a pig as I want to, but at the end of the day, you're selling to experts.
yeah,
They're gonna, I mean, you're not gonna pull the wool over their eyes, right? And it's not a viral sort of thing, right? And so you have to play the long game, right? I think you have to have a very good product,
yeah,
but I also think that you got to recognize the sales cycle, right? And therefore, you know, you have to be, efficient, lean, and have the right people on the team,
yeah.
right? And so, there's always the risk, right? That maybe, it's like I, you know, you can be too conservative,
Uh-huh.
right? Meaning you're too lean and your revenues aren't growing. Yeah, maybe you're profitable, but you're a little slow, right? In terms of uh top line growth, right? And then the risk becomes someone's going to jump over you,
Yeah,
right? But I'll take that risk if I think I have a really good product. I,
yeah,
I will take that risk before I will, assume that I can change the sales cycle.
yeah.
Assume that if I'm burning, pick a number, 30, 40, $50 million a year,
Mhm.
that I'm going to be able to offset that with revenue. I mean, it just doesn't work that way, I don't
No,
think.
no, it doesn't. And I think the way that you structure your team is interesting because and this actually ties us nicely back into the beginning part of the conversation about your background, because you have what, 4 or 5 salespeople, something like that.
Probably a little bit more now. We're about 7. We
Okay,
picked up
so
a few. Yeah.
7 salespeople, a small customer success team, like, and then most of
Pretty
your
pretty small R&D
yeah,
team.
yeah. So what is 40, 50 people in the company?
Yeah, we're at about 34 now.
Oh, okay, that's 34, and
Yeah.
you're running.
It's
I
it's
mean,
almost it's almost embarrassing, right?
w-
I mean, because, like, but if I, pick your metric, right? If I
yeah,
look at revenue per employee, we're
yeah.
kicking ass,
Oh yeah.
right? I mean, we're doubling ARR year over year, right? For the last couple of 3 years. Um, and and I think now's the time to start pressing,
Yeah.
right? A bit, because you got brand,
Mhm.
right? You got product, right? And good reputation, right? But you still have to hire the right people, right?
Yes.
And you can only do that at a certain pace.
Mhm. Yeah.
Yeah.
I mean, you've got the whole thing of, if you bring on 5 people, do you have the capacity to onboard
No,
5
we're
people at
still
once?
having growing pains going from, you know, 10 to 20 to 30.
Yeah,
You
exactly.
know? I mean, I can't even imagine, uh, you know, the organization being at 100 people. I
Yeah.
mean, I think we'll get there, right? But the infrastructure is still sort of a works in progress
Yeah. Y-
to do that.
You need a solid house. And I think,
Yeah, exactly.
yeah, back to that beginning about your background. I think, and you might not even realize this, but the biggest mistake that I've seen in AI companies when they're hiring their teams is they structure them like traditional radiology companies. And what I mean by that is your Philips. A lot of these AI companies, right? They're either ex GE, they're ex
Yeah.
Philips, they're ex Siemens, they're ex Agfa, Change Healthcare, Fuji, the big
Yep.
five, right?
Yep.
Um, and they have a rep for one rep for every state, maybe every two states, because you're selling a piece, an ultrasound. You're selling,
Exactly.
maybe not an MRI, but like an X-ray or something. You've got all of these target accounts that need these products. And so
Yes.
they go from the Fujifilm to, for all argument's sake, a Riverain. And they say, right, we need four people on the East Coast. We need four on the
I
West. We need
agree.
four Central.
Yep.
And you're not selling an ultrasound. You're not selling an
Exactly.
X-ray. Half of the
You're
hospitals.
developing a market. I mean,
Exactly.
you're truly developing a market, right?
Yeah.
Yeah.
Exactly, and half the hospitals, in reality, they won't need the product. They
Right.
don't do enough lung scans. They might not even, do lung whatsoever, right?
Exactly.
Um, and so they build them like a traditional radiology company. And I think
Yep.
maybe the uniqueness of your background in terms of not having that has probably allowed you to
Think about things a little
build a
differently.
market. Yeah, I think to
Yeah.
build a market.
Yeah.
So I guess on building, we'll sort of wrap up. What is next for Riverain? What do you said you want to get to 100 people, but how do you foresee actually
Yeah.
doing
So,
it?
I mean, so we will stay in the chest. From our perspective, there's plenty of work to do in the chest, right? So
Yeah.
between the lung and the heart,
Uh-huh.
right? A lot of use cases. I
Yeah.
think, lung health is getting increasingly recognized.
Yeah.
And the way we think of the space is, you know, it's a combination of breadth and depth,
Mhm.
right? So there's certain use cases that deserve a lot of depth, right? And when I say depth, I mean like, going from, visualization to detection to diagnosis to, I should say, visualization, detection, characterization, diagnosis, right? And then even maybe an element of patient management, right?
Mhm.
Although I kind of shy away from that because that's not our cup of tea. It gets
Yeah.
back to what we said before, right? We can't be all things to all people, right?
Yeah.
So partnerships, right, to this point have been sort of
Mhm.
the model, so to speak. Um, but so like now we have in the market, we have in CT, we have lung nodules, CAC, we'll have emphysema, we'll have a solution for aortic health, skeletal health. So
Yeah.
we're gonna, so we're basically creating more breadth, right?
Yeah.
And then for certain use cases, more depth, right?
Yeah.
But the common denominator is that we're not going to put something in the market that isn't a very good product,
Yeah.
right? And we're fundamentally not playing a game, right? I mean, we're not appeasing investors. We're building things to sell things, right?
Yeah.
I think sometimes the whole we have you know 10, 15, 30, whatever FDA clearances, it becomes a little bit of a game.
Yeah. It's a marketing game.
It's a marketing thing because, so what at the end of the day,
Yeah.
right? If the user doesn't buy it. And so, yeah, so we'll just keep, trying to be innovative, trying to have certainly raw performance that is,
Mhm.
better, right? And then also have some sort of creative elements that create some uniqueness, like vessel suppression, bone suppression.
Nice.
Um, and then, so like we're basically exclusively selling into the providers at this point. there's lots of opportunity in pharma that I'm
Hmm.
looking at, right? And so I
Right.
think that could be an interesting vertical
Yep.
because you're basically using the same tools, but you're using them in a different way.
Oh yeah. It's huge. There's a couple companies that are doing that.
For sure, right?
Um,
And so, um, but yeah, so I think plenty of work to do. We'll sort of we'll continue to grow the team commercially, R&D, right? But we will continue to stay focused on the chest, right? And
nice.
really try to build the best products on the market, right?
Yeah.
As it relates to chest and heart. But one
Yeah.
other thing I wanted to share with you which is this whole issue, right, or philosophy around scale and how fast you scale.
Hmm.
So, like, there was a day and a time, right? So, like, I took over as CEO of Riverain in 2013, and you know, we were on shaky ground. I'll put it
Sure.
that way, right? We were barely surviving, right? And so but we stayed lean and we kinda kept at it, right? And we tried to live within our means. I think that was a healthy process,
Yes.
right?
For sure.
You know, as opposed to, like, just, it's all about the next round kinda thing. It's like,
Yeah.
just back to back to the basics, right?
Yeah.
You know, kill
Yeah.
what you can eat. Eat what you know what I mean? That's yeah.
Yeah. For
I think
sure.
that's healthy.
My my last question was going to be, what advice would you give to other founders? But I feel like live within your means
I think that's
and
exactly it. Yeah.
kill what you eat and
Yep.
stick in your lane and to build
Yep.
good products.
Focus, focus, don't try to be all things to all people, you know, recognize the sales cycle, right? Um, so that it requires some patience, right?
Hmm.
Play the long game and just don't get over your skis because it's just very disruptive, right? And it ultimately can kill you,
Yeah, for
you
sure.
know?
Because unfortunately, we're going to see, over the next few years, I mean, we're going to both be at RSNA. We'll walk around, we'll see companies this year that we didn't see last year, and we probably
Yep.
won't see next year,
Yeah.
which is sad,
Exactly.
but,
Yeah.
you know, um, yeah, well, I guess on that regard then, uh, unless there's anything you want to shout out, you're going to be at RSNA,
Yep.
come by the booth,
I would love you to
anywhere
come
else.
by the booth. Been
Yeah,
very impressed with you. You're a very atypical, I hesitate to call you recruiter because I feel like you're a lot more than that, right? But you're obviously very thoughtful, right, about the market and you know what works, what doesn't work, which I think is it's very unusual.
appreciate it. Well, we
Yeah.
get to speak to a lot of smart people, and it's a it's a privilege to be able to do so.
Mm.
Um, is anything that you want to shout out about Riverain? Where can people find you? You know, anything
Yeah,
you
I
want
would just definitely come find us at RSNA, right? And we'll be showing some new products that we're bringing to market.
to?
So
Nice.
giving a little bit of view into the future. And yeah, I think we feel honored to work in this space, right? And sort of, you know, apply skills like chord problems that ultimately have a, significant meaning, right?
Yes,
To people. And I
exactly.
think that's a privilege, right? And yeah, I think that's it. I think
Well,
just keep at it, huh?
excuse the lung pun, but it's a fresh of breath air. I've just got the pun completely wrong, so ignore. I'm going to cut that bit out. Um, no, we'll keep that in. It's a breath of fresh air. Hearing that, there we go.
Oh,
Uh, the
yeah.
delivery wasn't there. Um, Anyway, appreciate you coming on.
Sure.
I look forward to catching up with you soon.
All right, very good.
All right.
Have a great day.
Cheers,
Appreciate it.
Steve.
All right, bye.